Newborn puppies and kittens, like human babies, are dependent on their mother during the first few weeks of life for warmth, protection, and food. However, sometimes it is necessary for you to help take care of the puppies or kittens. This could result from a mother's illness, low production of milk, or a litter larger than she's capable of supporting on her own, or a combination of all of these factors. In these cases, the mother will remain the primary caretaker, and your role will be to provide supplemental food. In the unfortunate circumstance of a mother's death or abandonment, you will not only be responsible for all of the feeding, but the caretaking also. This video has been designed to help you feed and care for your newborn puppy or kitten. Some of the materials you will need are eukanuba milk replacer formula for puppies or eukanuba kitten milk replacer formula, lukewarm water, puppy or kitten bottles and nipples or a feeding tube from your veterinarian, bowls, facial tissues or cotton balls, and sealable bags. Eukanuba milk replacer puppy formula and eukanuba kitten milk replacer formula are available at local pet stores and veterinary clinics in 10-ounce containers. Typically, one can will feed one kitten from birth through weaning, approximately 3 weeks. A medium-sized puppy will typically require about 4 cans during this same period. The first step in supplementing or feeding a puppy or kitten is preparing the milk replacer. After opening the milk replacer package, you should find a small white packet. This is the oxygen absorption packet. Do not discard or open. This oxygen absorber helps prolong the freshness of the milk replacer powder. The ratio for mixing the puppy or kitten milk powder with water will always be the same: 1 volume milk powder to 2 volumes warm tap water between 100 and 110 degrees Fahrenheit. Use a fork or whisk to gently mix the dry product with water until it has dissolved completely. How much milk replacer you prepare should always depend on how much the puppies or kittens will require. The feeding guidelines on the can will help you estimate about how much your pet should eat based on age, weight, and size. This will also determine how much you should prepare. Each can comes with a scoop to measure the milk powder. If you use the scoop for measuring water, be sure to dry the scoop before returning it to the can to maintain optimal freshness of the remaining milk powder. For ease in mixing for large litters, 8 level scoops of milk powder can be added to 1 cup warm water. You can also mix enough for an entire day, but should take care not to mix more than can be used in 24 hours to avoid spoilage. The mixture must be refrigerated between feedings, and each feeding should be warmed to about 100 degrees Fahrenheit before offering it to your puppy or kitten. There are several ways to warm milk replacer, such as running it under warm water for several minutes, or placing it for a minute or 2 in water that's heating on the stove. The easiest is to warm it in the microwave for a few seconds, then gently shake the mixture to evenly disperse the heat in the fluid. Test the contents before offering it to make sure the liquid is warm, not hot. The easiest way to test the fluid is to allow several drops of milk replacer to fall on the inside of your wrist. It should feel warm, but not uncomfortable. Unopened, a can of milk powder can be maintained for up to 2 years. Once opened, however, the unused portion of milk powder must be stored in the refrigerator, then any remaining powder must be discarded after 2 months. Remember, to mix milk replacer, use 1 volume milk powder with 2 parts warm water. Stir until completely dissolved. Store the milk replacer in the refrigerator between feedings, discarding the unused portion after 24 hours. Store the opened can of milk powder in the refrigerator, discarding the unused portion after 2 months. Warm any refrigerated milk replacer before feeding. Newborn puppies and kittens start off eating frequent, small meals. A normal newborn should eat about every 4 to 6 hours and be satisfied. In the cases of low milk production, almost all the puppies or kittens will need to be supplemented with milk replacer. In the cases of too large a litter, usually only a few puppies or kittens will need to be supplemented. In both cases, it is nearly impossible to gauge how much the puppy or kitten has received from the mother, so it is difficult to calculate how much replacer to supplement. The best way to supplement is to let the puppy or kitten decide how much it needs after nursing from the mother. Typical signs of a hungry puppy or kitten include constant crying, inactivity, and slow growth, and you may not need to supplement after every feeding. If you are the primary food provider, you will need to create a schedule for feeding the newborn puppies or kittens. Remember, most newborn puppies and kittens eat every 4 hours. At first, the puppy or kitten will consume only a small amount of milk replacer. The amount it eats at each feeding will gradually increase during the following weeks as its stomach size increases, and the interval between feedings will gradually increase to about every 6 hours. Bottle feeding is the easiest way to feed. Most pet stores and veterinary clinics now carry nursing bottles and a variety of nipple sizes and shapes made specifically for puppies and kittens. Puppies tend to prefer short, wide nipples, while kittens prefer long, narrow nipples. Breed size will also determine the best nipple size for your puppy. Pay close attention when preparing the size of the nipple hole. The hole should be large enough that when the bottle is turned upside down, a milk droplet is formed. If it does not, you will need to enlarge the hole by inserting the heated tip of a sewing needle. Then remove the needle and check the size again. Avoid using a nipple that allows the milk replacer to flow freely from the nipple when the bottle is inverted. Using a nipple with too great a flow rate will increase the risk of aspiration pneumonia, a type of pneumonia resulting from the intake of liquid into the lungs. Once the bottle is ready and the milk replacer has been prepared, place your puppy or kitten in the proper feeding position. Puppies and kittens should be upright with their belly down and head slightly higher than the rest of their body. Some puppies and kittens may prefer leaning to the side. Invert the bottle so that the nipple is pointing down towards the puppy or kitten's mouth. To encourage nursing, it helps to put a drop of milk replacer onto the tip of the nipple before offering it. Let the puppy or kitten drink at its own pace. Never squeeze the nursing bottle in an attempt to increase the rate of consumption. If the puppy or kitten starts choking or milk starts coming out of its nose, remove the bottle immediately. If the puppy or kitten develops abnormal breathing, fever, coughing, or wheezing within 12 to 24 hours after this occurs, contact your veterinarian immediately. Most kittens and puppies will stop eating when they're full. However, some will overeat. If your puppy or kitten regurgitates after feeding time, or they're eating noticeably more than the expected intake amount, feed a little less and more frequently. Remember to bottle feed a puppy or kitten. Purchase the appropriate nipple and bottle. Check the size of the nipple hole so that when inverted, a milk droplet forms. Increase size as needed, but avoid freely flowing milk. Hold the puppy or kitten with its belly to the palm of your hand so the head is higher than the rest of the body. Offer the bottle so the nipple points down to the puppy or kitten's mouth. If your puppy or kitten won't take the bottle or doesn't have a strong sucking reflex, you need to see your veterinarian for instructions on other feeding methods. You may want to try feeding through an eyedropper or syringe without the needle for very young puppies or kittens first. Be sure to administer the milk replacer slowly with frequent stops so the puppy or kitten doesn't get fluid in its lungs. If you must tube feed, your veterinarian will show you how and give you the necessary equipment. Please do not attempt to tube feed without instruction from your veterinarian first. The following instructions are meant as a visual aid to what your veterinarian has already told you. The puppy or kitten should be placed in the normal feeding position described earlier, with its mouth open slightly. You may find that it helps to dip the tube into warm water before passing it into the esophagus to provide lubrication. Gently pass the feeding tube down the esophagus as your veterinarian has shown you. If the tube hits an obstruction or encounters any resistance, retract the tube slightly and try again. Never force the tube in. Once the tube is inserted, Put your ear close to the open end of the tube and check to make sure there are no breathing sounds coming from the tube. Breathing sounds mean the tube is in the lung and needs to be retracted. When the tube is properly in place, slowly squeeze the formula from a syringe into the tube. This feeding should last about 2 minutes so the stomach can fill slowly. To remove the tube, gently but swiftly pull it out. If your pet regurgitates, retract the tube and interrupt feeding until the next meal. The feeding tube should be thoroughly cleaned with warm, soapy water after each use. Newborn puppies and kittens rely on their mother for more than just food. They also need warmth, special care, and attention during the first few weeks of their lives. If the mother is able to care for her litter, let her. However, if you are acting as a surrogate parent to an orphaned or abandoned puppy or kitten, there are several things to keep in mind. The ideal spot for a newborn puppy or kitten is in a draft-free room with a temperature of about 90 degrees Fahrenheit. The environmental temperature can gradually be lowered to 75 degrees during the next 3 weeks. Be sure to allow the puppy or kitten a place to get away from the heat should it become too warm. If at feeding time you notice your puppy or kitten is cool to the touch, warm it up before trying to feed. Never feed a chilled puppy or kitten until its rectal temperature is near 100 degrees. If the puppy or kitten seems dehydrated, offer warm water or warm Pedialytes only until its temperature has returned to normal. At least twice a week, the puppy or kitten should be wiped down with a soft, warm washcloth that has been well wrung out. When a mother licks her litter, the stroking of her tongue near the genital and anal areas acts as a stimulant for fecal and urinary output. For the first 7 to 12 days of life, you will also be responsible for this stimulation. About 10 to 15 minutes after every feeding, hold the puppy or kitten in your hand, belly side up, with the head slightly higher than the rest of the body. Using a moist cotton ball or facial tissue, gently and rhythmically massage the genital and anal region. Continue massage for 10 to 15 seconds. Collect the excrements with a facial tissue. Seal in a plastic bag and dispose in the wastebasket. Normal urination for kittens and puppies is pale yellow in color. Feline fecal output will look greenish-brown in color, while the puppies will be light brown. Both will start out slightly soft, but will firm as they age. Remember to stimulate excretion in an orphaned or abandoned puppy or kitten. Hold the puppy or kitten belly side up with its head elevated. Massage the genital and anal region for 10 to 15 seconds with a moist cotton ball or facial tissue, 10 to 15 minutes after every feeding. Collect the excrements with a soft tissue and seal in a plastic bag. Dispose of the excrements into the wastebasket. Most puppies and kittens benefit from gentle handling, such as petting and holding, before feeding as a means of exercise and development. As your puppy or kitten grows, it is important to keep track of its development so that you can spot and treat any problems early. Creating a chart, such as the one shown here, can be an effective tool for tracking your puppy or kitten's milk intake, growth, and developmental milestones. After every feeding, record how much your puppy or kitten ate and at what time. At about the same time every day for the first 2 weeks, record your puppy or kitten's weight. After 2 weeks, you can weigh your puppy or kitten every 3 days or so. The basic guidelines for healthy puppy growth depend on how much the puppy will weigh as an adult. Puppies should gain 1 to 2 grams per day for every pound they will weigh as an adult. For example, if your puppy will weigh 20 pounds as an adult, it should gain between 20 and 40 grams or 1 ounce each day for the first 3 or 4 weeks. Most cats don't vary too much in adult weight and will have a similar weight gain. A typical kitten should gain 7 to 15 grams per day or 2 to 3 ounces per week. A healthy puppy or kitten will double its weight approximately every 10 days. Raising a puppy or kitten can be a stressful time that raises many questions. Don't hesitate to contact your veterinarian if you have questions. However, there may be circumstances where immediate attention from your veterinarian is valid, and it is important to be able to recognize those circumstances. Some of the signs of problems that require immediate attention include labored breathing, coughing, or wheezing, eyes that remain cloudy as the puppy or kitten grows, excessive discharges from the eyes, ears, or nose, excessive gas, infrequent or abnormal urination and defecation, or prolonged diarrhea, decreased movement or excessive vocalization, dehydration, fever, or consistently reduced appetite. If you notice your puppy or kitten has one or more of these signs, contact your veterinarian immediately. When puppies and kittens have fully opened their eyes and are standing freely, you can begin the weaning process. And this typically happens about 3 weeks after birth and is a gradual process. Puppies and kittens should be introduced to bowl feeding first. To do this, put the eukanuba milk replacer in a bowl and place it on the floor where the puppy or kitten can get to it. It is best to put the bowl down during normal feeding time and remove it as soon as the puppy or kitten is finished or 30 minutes has elapsed. This way the milk replacer won't spoil. Once the puppy or kitten is comfortable lapping from the bowl, begin mixing a small portion of eukanuba weaning diet formula for puppies or kitten food in with the milk replacer. Kittens can also be weaned to IAM's canned kitten formula. For kittens, gradually increase the amount of kitten food while decreasing the amount of milk replacer through the next 3 weeks. For puppies, eukanuba weaning diet formula should be increased as milk replacer is decreased. Then begin introducing the appropriate eukanuba puppy food into the weaning diet rule. Eukanuba small breed puppy formula, eukanuba medium breed puppy formula, eukanuba large breed puppy formula, or eukanuba puppy natural lamb and rice formula. Decrease the amount of weaning diet while increasing eukanuba puppy food for about a week or 2. By then, the puppy should be eating eukanuba puppy food only. During the transition from milk replacer to solid foods, it is important to ensure that both puppies and kittens have access to fresh water at all times. And, as with any diet change, you may notice some temporary changes in stool consistency. Remember to wean your puppy or kitten. Place the milk replacer in a bowl so the puppy or kitten can learn to lap. Provide fresh water. For kittens, add a small amount of eukanuba kitten food to milk replacer, then gradually increase the amount of solid food while reducing the amount of milk replacer. This should take approximately 3 weeks. For puppies, add a small amount of eukanuba weaning diet to milk replacer, gradually decreasing the amount of milk replacer at feeding times. Begin adding eukanuba puppy food to the weaning diet. Gradually decrease the amount of weaning diet until the puppy is eating eukanuba puppy food only. Feeding and caring for newborn puppies and kittens requires a lot of time, patience, and dedication. But with the help of eukanuba milk replacer, it can be one of the most rewarding experiences you share with a puppy or kitten.